A year-long blockade on food aid and vital services, such as telecommunication and banking, has left many in Tigray desperate for essentials, even food. One way communities in Maqala have been supporting one another is through breakfast feeding programs for children. Kiradion Charity Organization is just one of a few local charity organizations collecting funds as little as $1 to organize a daily breakfast feeding program here in Maqala. Every morning, 200 children gather near the Asr Shadishak Abli Commercial Bank to receive just one bread and a cup of tea, very likely the only meal they will have that day.
We have more than 200 children that we feed breakfast on daily basis, and we have orphans that we help, and we have IDPs, which all of this comes from the community itself. So the challenges are tremendous, and the price of food has skyrocketed. As you know, the price of bread right now is very, very high. It's unaffordable. So all of those things are the challenge. These are the main challenges, but the challenges are, you cannot count them. There are so many.
But other charity organizations also take these opportunities to provide other badly needed services. Dr. Sofones Malaku is the founder and CEO of Ma'adut Charity Organization. His charity is providing free screening and treatment for IDPs and children suffering from communicable diseases. Him and other doctors from Ma'adut have gathered here this morning to provide free screening and treatment for children that are suffering from scabies and other communicable diseases.
Today our focus is primarily on a disease called scabies. And it's one of the communicable, it's a highly contagious infectious skin disease, and it's caused by a parasitic agent called Coxella labranti. When it comes to conditions like the ones that we are facing right now, the siege, the war, the lack of food, the lack of sanitation materials and lack of hygiene materials, you deal with complicated cases of scabies. One of the challenges that you face with this disease is that since it's very irritating and itching, the children, they scratch the lesions, the skin lesions. So there are no hygiene materials. You can expect what they are doing when they do that. They introduce other pathogens into the lesion. And you deal with a variant called super-infected scabies. To manage that, you will need antibiotics, which we don't have currently in abundance. So today, our primary aim is to sort out the cases that we can manage, and give them whatever available medications that we do have. And as part of the assessment, we're looking for other infectious diseases that we may seek out.
I always come here to eat breakfast. Today, I'm also getting treatment. I have been suffering with this condition for the past year. I'm always scratching my thigh and my arms, especially at night.
Dr. Sofones says scabies is actually an easily treatable communicable disease, had it not been for the destruction of almost 80% of health facilities in Tigray. He says the near-complete collapse of the health system, in addition to the siege that has discontinued banking and other vital services, has made it impossible for patients to seek care or maintain basic hygiene.
I've been scratching my skin for almost 3 months now. Even though I knew I had scabies, I didn't know where to get the medication.
Dr. Sofones and Ashanafi tell us that the work of charity organizations such as theirs falls far short of the intervention needed to address the humanitarian catastrophe on the ground. They say the world has to do more to ensure that the most vulnerable members of community have access to basics such as food, soap, and medication.
The siege is not able to stop, a lot of ensuing issues are not going to be solved. Like banking, the health service, the medications coming in, a lot of the systems within the region. And if that doesn't change, we're going to deal with a lot of issues that will have a lot of ripple effects. And we're going to deal with this for a long time unless it's done early. And I urge the international community to act now. We have to act now because we are losing people.
As a matter of fact, we're standing in front of a bank which has not given service for almost a year now. But many people apparently have money here, but they cannot access it. So many people are suffering because of the war, because of the siege, because of the atrocities that has happened in Tigray, that has been committed in Tigray. So I say onto the international community that they have to do whatever they can as quick as possible because we are racing against time right now.